Hello and welcome. Thank you for finding this video on making Medicare simple. My name is Howard Polanski. I am one of the principals of Silver Key Benefits of Texas. I just wanted you to see my face before we got to the slideshow. My goal here in this video is in under 30 minutes to explain Medicare on a high level. Now, please understand this is very broad topics. Obviously, everyone's going to have their own specific and unique situation, but to understand Medicare, the complexities of it, and break it down into simplistic terms, also with the key understanding that everyone's plans are going to be different, not only inside Texas, which is where I'm going to focus, but between states, different plans in different states. So this is going to be a Texas related webinar that you're going to be watching. But if you need help in other states, you can reach out to me, and I do have other contacts that are licensed in other states. So let's begin. And from the beginning. So making Medicare simple. And who we are. Silver Key Benefits of Texas was founded by Steve Dikovic. I partnered with Steve in 2018. And we do look at retirement in the greater aspect in terms of how does Medicare work? Where does long-term care play into Medicare? Is long-term care inside of Medicare? How am I going to create an income with the assets that I have? What about my loved ones, not if, but when I pass away? So we do look at the entire spectrum. However, I'm going to focus only on Medicare with this video because that is why you clicked on it. So we are Medicare brokers. What does that mean? It means we do not work for one specific company. I know some people that are out there, they work for only United Healthcare or only Aetna, and they are great companies, but they don't have a plan that may fit your particular needs. And so because we don't work for just one company, we want to find the best plan that's for you in your unique situation. The other thing that's really nice about our structure is that there is no fee to use our services. Let me say that again. There's no fee to use our services. These insurance companies have a marketing budget. We are basically compensated out of their marketing budget to find the right plan for you and your situation. So it is a regulated compensation. The objectives with this video is number one, the overview of Medicare, how it works. Number two, how do the drug plans work inside this? And I'm going to simplify this down because it can get pretty complex. I'm going to touch on your income and your assets because they matter in terms of the plans that may be available to you, along with the other gotchas of if, depending upon where your income is, you may actually have to pay more for Medicare and people don't realize that. And then if you'd like to work with us, how do we get started? So here's our overview of Medicare. And I have this all on one slide. This is where the bulk of our presentation is going to be, okay? So on the top, I say Medicare here, and this is to signify the government, the United States government. Now, you may have been reading there are 4 parts to Medicare, Part A, B, C, and D. We will touch on all of those. Part A is hospital, hospice, skilled nursing care. And when someone turns 65 or they get onto Medicare, if they earlier than 65 because of possibly a disability, Part A is a $0 premium. So basically you turn 65, and I'm going to keep it simple and just say that we're talking about people that are turning 65. You get Part A from your vantage point at no cost to you, okay? Part B is the part that does have a premium. And Part B is your doctor visits, your outpatient surgeries, your durable medical equipment. Think of wheelchairs, think of walkers, think of sleep apnea equipment. There is a premium for Part B. In the year 2021, for 93% of the population, that Part B premium is going to be $148.50 a month. If you are collecting Social Security, you have your gross Social Security, they will take out this Part B premium of $148.50. The rest goes to your checking account. If you are not collecting Social Security when you get onto Medicare, you will get a quarterly invoice. So multiply, make it easy, 150 times 3, you'll get something for just under $450 every 3 months. Yes, it is a legitimate bill. Yes, you need to pay it. If not, you will not be on Medicare. Okay. Now, Part A and B, Medicare covers 80% of your medical costs. So if you go to a doctor and the visit is $100, Medicare will pay $80 of that. You will owe $20. If you are in the hospital and let's say you are there for 12 days and the total bill comes out to $100,000, Medicare will pay 80% or 80,000. They will turn around to you and say, or to me, pretend it's me, Howard, you owe $20,000. You owe the other 20% because there is no maximum on the 20%. So we don't want to have this, oh my goodness moment. How do we protect ourselves in the 20%? So I'm going to start here on the left-hand side, which I'm saying public Medicare. And we would get what's known as a supplement, okay? Now, in Medicare's infinite wisdom, they used parts A, B, C, and D, and then there were different plans for the Medicare supplements from A all the way to N. If you are turning 65 now and watching this video, your choice is only Plan G. So that is what I'm going to focus on. You are going to end up with 3 cards. Number 1 is what we call the red, white, and blue card. It is the Medicare card. It's a bunch of letters and numbers and has what's known as your effective date when you first got onto Medicare for Part A and for Part B. This supplement will pay the remaining 20%. So go back to that $100,000 bill. Medicare will pay $80,000. Your supplement will pay the remaining $20,000. No other out-of-pocket cost to you. With being on public Medicare, you can see any doctor that takes what I call original Medicare, which is 99.9% of doctors out there. Who does not take it? You will find a few psychiatrists that will not. You will find some plastic surgeons that will not do it, okay? But just about every other doctor will take original Medicare. You can go to any hospital in the country, anywhere in the country, and you do not need a referral. So you can see your general doctor on Tuesday, you can see a cardiologist on Wednesday, you can see a pulmonologist on Thursday, you walk in, you walk out, you don't have a bill. Sounds great. What's the catch? The catch is for this supplement, you will have to pay a premium for that. It is roughly based on age. There's a couple other factors, but let's keep it simple. When someone turns 65, the cost of the supplement will be about $90 to $100. But as we get older, the chances and the risk of going into a hospital and needing more doctors goes higher, and the insurance companies are aware of that, and so the premium increases. When my grandmother passed away, may she rest in peace, she was 1 week shy of 101. The premium for her Medicare supplement was around $400 a month. So it does increase with age. If you realize, we have not spoken about drugs yet. Drugs is Part D of Medicare, and you will need a separate drug plan, a separate Part D. And in 2021, there is a drug plan as cheap as $7.30 a month, going all the way up to $80. Okay. And so that'll be a separate slide. But when you add it all up, it is very, very flexible in terms of who you can go see, where you can go see them. There is a tiny deductible. The deductible for 2021 is $203 for the year. Basically, what Medicare is asking of you is that you pay for the first 1 or 2 doctor visits. After that, if it's a Medicare approved procedure, it is covered. And I put this as neutral as the costs are upfront. If someone is very healthy and does not go to the doctor, this acts like car insurance. You pay every month. You don't want to get into an accident, but you understand the risk of, if I don't have this, it's going to cost a lot. Okay. So if someone is very, very healthy, they go to the doctor just once a year, you're paying, call it $110 a month for several years. And you're like, is this really worth it? Okay. Is there another way to do Medicare? And the answer is yes. So now we're going to go to the right side of the page, which I call private Medicare. And this is the final part of Medicare, Part C. This is known as the Medicare Advantage plans. And this is what you see all of those commercials for when it's October 15th and November and the first week of December. Okay. Why do I call this privatized Medicare? And that is because when you go this route and take an Advantage plan, the United States government is technically not administering your Medicare anymore. You have now contracted this out to an insurance company to manage Medicare on behalf of the government. I'll say that again. You now have said, if you pick a United Healthcare PPO plan, what you have said to the United States government is United Healthcare will administer my Medicare on behalf of the United States government. So now United Healthcare is making the decisions in terms of, yes, this is an approved procedure, or no, it's not. Okay. And this is very, very close to what you know in terms of regular medical insurance as you grew up in the working world, where you have PPOs and HMOs. You will end up using just having one card. Okay. So instead of having a drug plan card and a supplement card and the red, white, and blue card, if you need to go to a hospital, if you need to see your doctor, if you need to go get some medications, you show just one card. That covers everything. With an HMO, it tends to be cheaper. PPO can be a little bit more expensive when it comes to like copays. Also, in terms of premiums, you can find some $0 premium plans, both HMOs and PPOs, but there could be a higher cost. With the HMO, a lower copay. So if you needed to go see a specialist, it could be $30 a visit. If you went on the PPO, it could be $50 a visit. With the PPO, as long as you stay in network, you don't need referrals to the specialists. This can include the drug plan built into the plan, so you don't need a separate drug plan like you do on the left-hand side. But the downside is the networks. In order to use this effectively, you have to see doctors that are in network. All right. So when we sum this all up, it is cheaper up front because it is a pay-as-you-go plan. Meaning that if it's a $0 premium up front versus the roughly, call it $100 a month for a supplement, if you don't go see a doctor, you don't have any other expenses with this. Okay. But if you do end up in a hospital, it could end up being more costly than having the supplement in place. There are added perks, okay? So, because people say, well, why do they call this an Advantage plan? There's 4 things that Medicare does not cover. They do not cover dental. They do not cover vision, meaning eyeglasses and contact lenses. They do not cover hearing aids. They do not cover facelifts. So if you're hoping to get that cosmetic surgery once you are on Medicare, you are out of luck. Okay, not going to happen. But because these Advantage plans are administered by third-party companies, and let's just take out the financial side of how this all works, they are allowed to offer other perks above and beyond just the basics of Medicare. So you can find plans that will offer pretty decent dental coverage, discounted hearing aids, They will give you a credit towards getting glasses or eye or contact lenses every year. You could have acupuncture visits, chiropractic visits. You could have transportation to and from doctor's offices. Okay. The downside of all of this is that you have to stay in network for this to be effective. So let me kind of give three scenarios here that gives a pretty striking difference in terms of left side, right side. And that usually, when I'm talking to people, gives them the understanding of which way they want to do Medicare. Okay, so scenario number one, we're here in Central Texas and you go on vacation to San Francisco. Okay, and God forbid you have a heart attack. Well, what happens? Because a heart attack is a life-threatening condition, no matter what plan you have, you are covered. Period. End of story. Let's say on a different trip, you go to Orlando, Florida, and you get a case of the shingles. What happens there? On the left-hand side, if you have this supplement, because you can see any doctor, any hospital, anywhere in the country, you do not need a referral, that visit for the shingles will be covered. If you have an Advantage plan, the company could come back and say, we know shingles stinks. However, shingles is not a life-threatening condition. You were out of your geographic zone. The bill is on you. Now, I will say some of the companies have gotten better depending upon the plans, but as a very broad rule, that's how it works. Final scenario. You get a diagnosis of cancer. With me living in Central Texas, the next immediate thought is, I want to go to the best cancer hospital in Texas. I'm willing to drive myself to Houston to go to MD Anderson. If I have a supplement, they will be happy to see me. If I have an Advantage plan, they do. MD Anderson is not in network with any Advantage plans in the Central Texas region. You will have to pay completely out of pocket if you want to go see them. Understand, there will be oncologists that are in network with these Advantage plans, but not MD Anderson. Okay, that's Medicare in a nutshell. Next questions that people ask is, well, there's the left side and the right side. How easy is it to go from one side to another? And the answer is easy, kind of, sort of. Okay. When someone turns 65, you are allowed to pick anything that you want. Health questions do not matter. Okay. All of the insurance companies have to take you once you turn 65. That's part of the rules. After the age of 65, if you started with a supplement and you're like, well, I want to try an Advantage plan. I wonder if it's as good as all the commercials make it. You have a 12-month trial period to try an Advantage plan. Okay. So with this being the year 2021, if you have been on Medicare for a while, you've only had a supplement, you say, I want to try a Humana Advantage plan for 2022. Anytime over the next 12 months, whether it is January 3rd, April 18th, December 29th, you have the right to go back to your supplement, no questions asked. Once 2023 hits, the only way you can get back to the public side is by answering health questions. So if you are healthy or moderately healthy, you have a good chance of getting back over here. If all of a sudden you come down with a condition that they will not take you, you are stuck on the privatized side. In terms of changing from Advantage plan to Advantage plan, there are no health questions on that. So you can change every year from United Healthcare to Aetna to Humana to back to United Healthcare. Does not matter. They have to take you. Okay. So those are really the big things in terms of Medicare and how this all works. Here's the real big questions that I ask to kind of figure out which way might work out the best for you, the client. Number one, do you want flexibility of doctors? For some people, that means everything to them. To say, I don't want to be beholden to a network anymore. I want to choose the doctor of my choice. And if that's the case, we're going on the public side and getting a supplement. For others, doesn't matter. Just as long as there's good doctors out there, I'll take whatever it is within the network. Do you want to know your costs up front or pay as you go? For some people, they have that flexibility. I've met others that have limited funds. And so the pay as you go really becomes the only option. For others, the knowing the costs up front to say, here's my premium, here's the small deductible I have to pay, I'm covered. The final question, and this is more of me just getting to know you as the client. Are you go, slow go, or no go? What I mean by that is a go is someone that is still traveling around the country, around the world. They need to know that their insurance goes with them no matter where they go. And if that's the case, we're strongly looking at a Medicare supplement. I mentioned my grandmother. When she was living here in Central Texas, she wasn't going anywhere. Okay? If it was not within 10 miles of where she lived, the rest of the earth could have just fallen off. It did not matter. She was a no-go. She could have done a Medicare Advantage plan and could have worked very effectively for her. For someone that's a slow go, they're usually kind of homebodies. They may take a trip every once in a blue moon. And so then the other couple questions really matter in terms of what are the values to you that makes sense in terms of which policy do we go with. Drug plans. If you noticed, everything I was talking about was medical, and then there's drugs. They're two separate buckets. Okay. Now I'm going to just really oversimplify this. You can get into some really big weeds with this. But in regards to the drug plans, you have its own deductible with the drug plans. And in 2021, the annual deductible is $445. So up for the first $445, you're on your own. Then you have a period of time where you have coverage. Then once you get to roughly $4,100 of prescription costs, your drug plan disappears for a while. But then if you have really super expensive drugs that get over $6,500, your drug coverage comes back. And that place where it disappears for a while is known as the donut hole. Just understand this, that has shrunk over time, and there are 5 levels of medications. Tier 1 and Tier 2 are your generic medications. 3, 4, and 5 are the ones that are specialty medications or brand name. This is where the donut hole really affects those people. Okay. That's as much as I want to touch on because you can just get way into the weeds. But there are 2 important things that were positive changes for 2021 and should extend moving forward. One of the things in terms of that tier 3, 4, and 5 meds that people were getting nailed in the donut hole were these injectable insulins, because they needed 2 different types of insulin. One was fast acting, one was slow acting. And it would cost seniors roughly in the neighborhood of $300 to $400 per month to have these 2 separate medications. And they would call me up roughly in August or September and say, why did my drug prices go from $100 up to $400 a month? And it's like, oh, you're now in the donut hole. And they're like, I don't remember you talking about that. So I've resolved that moving forward. But the drug companies or the companies that administer these drug plans realized this was a problem as well, because seniors are usually on a fixed income. So there are certain drug plans now that will moderate the cost of the drugs so that it comes out to usually under $100 a month for those injectable insulins. Again, it's plan dependent. We are allowed to change drug plans every single year with no medical questions. So this is something that I help people a ton in terms of finding the right drug plan with their pharmacy to figure out with their medications what makes the most sense. The other nice funny one is Cialis and Viagra. These two drugs are not approved by Medicare. However, they are generic, and some of the drug plans have added the quote unquote the perk or the value add of including them on their formulary. And so you may find them as tier ones and could cost you very little to make sure that everyone is happy. I'll leave it there. Income limits. There are special rules in place on both sides of the spectrum in terms of people that have very low income coming in and very high income coming in. Just want to touch on it really fast. If your income is low, and I'll give the breakdown here, there's the difference between single and filing jointly. If your income is single and it's under $1,084 a month, and again, this is in Texas, so please keep that in the back of your mind. If you are someone watching this in Kentucky or Arizona, or you're moving to those states, the numbers can change. But if you are single and under 1084 a month or under 1457 a month and you're married, there are special plans that open up for you that combine Medicare and Medicaid. These are very, very powerful plans, and ones that, if this is where your income limit is, definitely reach out so we can find that perfect plan for you. The next tier up goes from 1085 to 1296 for the single. For all intents and purposes, think of it as the federal government will pay the Part B premium for you of $148.50 a month, but you will still have the potential of the copays. The next tier up goes up to $14.56 a month if you are single. The Part B premium is paid, but you must apply each year because that is the state paying your Part B premium for you. So that's kind of the limits on the low side. What if you make a significant income once you hit 65? Well, there's something called IRMA. Long story short, it's the Medicare tax. Congratulations, you make too much money as an old person. I'm going to look at the filing jointly. Here you can see it filing single. Every number here is just doubled. So if you're only one person, it's 88,000. If you're two people, it's 176. The way that they do this, and it moves every year. Right now it's calendar year 2021. They look at your tax return from 2 years ago, 2019, the adjusted gross income, to determine if you are going to get hit with a Medicare tax. And it literally is by $1. So if you look, it says $176,000 or less, and then it literally says 176,001. So if you went $1 over, you're going to get hit with this tax. But let's just start with this first line. It's $148.50 for the Part B premium. This spreadsheet was using the mythical thing of a $20 drug plan, and you would pay the $20 for the drug plan. If your income in 2019 was $200,000, we would go up one level and you would see the Part B premium jumped roughly $60 a month. And the drug plan technically did not, the drug plan is still $20, but you got hit with the Medicare tax of $12.30. So, and here's the additional cost. So you can see line by line what these tier levels are and how much the premium and the taxes on this will go up. And so if there is someone that is in their 60s or 70s and making $750,000, it's going to cost them $14,448 per individual for Medicare. Okay. And with these numbers being cut in half for someone single, if you have a spouse who suddenly passed away, you may have had about $150,000 coming in. Now, all of a sudden, you're going to get hit with this on the single side, and your Medicare premium is going to go up. So, this is just something to be aware of. Also, if you sold a business when you were 64 years old, expect there to be a big jump up in Medicare when you're 66. It will then go down because then they will look at 2022. They're going to look at the 2020 tax return. 2023, they're going to look at the 2021 tax return. So just understand it will be a moving target moving forward. That's Medicare in a nutshell. And I know I got right up to the 30-minute mark. I apologize on that. Ways to connect. I have a questionnaire that you can fill out. It only comes to me. Here are the two different ways to get there. You can either go put this link into your browser, just type this in exactly, or if you have a phone, just scan this QR code, or call me, or email me. Any way you do it, I will see that information come in. I will be honored to help you navigate Medicare and make this simple for you. I want to thank you for your time, and I hope to hear from you soon.